Hello, everyone. It's Wednesday, February the 2nd. I appreciate you being with us and everything. And more than anything, we've lost an additional 51 people in West Virginia. Now we're at a death total of 5,814 deaths in West Virginia. I want you to give your respects and honor in every way to these great people we've lost. We lost a lot of wisdom in these people, and I'm sure we lost a lot of loved ones and friends and people that were really, really important to all of us, especially these families. So please pay your proper respects, and I urge you beyond belief, if you know them, please get in touch with these families. They don't want to feel alone. That's all there is to it, and we don't want these people to become a number in any way. The 5,764th death is an 87-year-old male from Kanawha County. The 5,765th death is an 80-year-old male from Kanawha County. The 5,766th death, a 93-year-old male from Kanawha County. The 5,767th death, an 82-year-old female from Jefferson County. The 5,768th death, an 84-year-old female from Berkeley County. The 5,769th death, an 89-year-old male from Raleigh County. The 5,770th death, a 92-year-old male from Brooke County. The 5,771st death, an 81-year-old female from Wood County. The 5,772nd death, a 99-year-old male from Brooke County. The 5,773rd death, a 93-year-old female from Berkeley County. The 5,774th death in West Virginia, and bless her soul in every way, a 104-year-old female from Kanawha County. What an incredible life. So many things she saw. It's unbelievable. The 5,775th death, a 62-year-old female from Berkeley County. The 5,776th death, a 71-year-old male from Monroe County. The 5,777th death, an 81-year-old female from Kanawha County. The 5,778th death, a 70-year-old female from Cabell County. The 5,779th death, a 78-year-old female from Greenbrier County. The 5,780th death, a 74-year-old female from Marion County. The 5,781st death, a 68-year-old male from Cabell County. The 5,782nd death, a 64-year-old female from Cabell County. The 5,783rd death, an 87-year-old male from Summers County. The 5,784th death, a 65-year-old male from Kanawha County. The 5,785th death, a 61-year-old male from Mineral County. The 5,786th death, a 72-year-old male from Mercer County. The 5,787th death, a 57-year-old male from Mercer County. The 5,788th death, an 86-year-old female from Kanawha County. Here's really bad. The 5,789th death, a 36-year-old male from Kanawha County. The 5,790th death, a 73-year-old male from Brooke County. The 5,791st death, a 65-year-old male from Ohio County. The 5,792nd death, a 68-year-old male from Harrison County. The 5,793rd death, a 72-year-old male from Raleigh County. The 5,794th death, a 75-year-old male from Lewis County. The 5,794th death is a 74-year-old female from Lewis County. The 5,795th death is a 65-year-old male from Kanawha County. The 5,796th death is a 73-year-old female from Brooke County. The 5,797th death is a 66-year-old male from Marion County. The 5,798th death is a 75-year-old male from Mercer County. The 5,799th death, a 78-year-old male from Wyoming County. The 5,800th death, it's just unimaginable. 5,800 deaths, an 83-year-old female from Kanawha County. The 5,801st death, a 65-year-old male from McDowell County. The 5,802nd death, a 77-year-old female from Mineral County. The 5,803rd death, a 55-year-old female from Mason County. The 5,804th death, a 64-year-old female from Logan County. The 5,805th death, an 80-year-old female from Harrison County. The 5,806th death, an 82-year-old female from Kanawha County. The 5,807th death, a 73-year-old male from Preston County. The 5,808th death, an 81-year-old male from Brooke County. The 5,809th death, a 76-year-old male from Hampshire County. The 5,810th death, an 88-year-old male from Kanawha County. The 5,811th death, a 58-year-old male from Mercer County. The 5,812th death is another tragedy, a 34-year-old male from Berkeley County. The 5,813th death is an 83-year-old female from Lewis County. The 5,814th death in West Virginia is a 70-year-old male from Harrison County. Before I go any further, just listen to me just 1 second about this, because I don't know these stats. I don't know exactly the bottom line on this. But you know what? In all that I read here, in 51 different deaths that we have, there were 2 in their 30s. I don't think there was anybody in their 40s. Hardly anybody in their 50s. If you'll just let me look real quick. Two people in their 50s, 2 people in their 30s. Really and truly, is this not saying to us, and it's something that we ought to dig a little deeper on than just this? It seems like, and I was going to say this to you before, but it seems like that this thing, the deaths are growing again with our elderly people. You know, there's an awful lot of our elderly people we've already lost. But all of a sudden, the deaths seem like to be growing with our elderly people again. And if that be the case, really and truly, is it not saying, I just wonder how many of these folks were vaccinated but did not get their booster shot? Because without that booster shot, you are becoming very exposed again. And if we're very exposed, then we know that this terrible disease has attacked our absolute elderly, and it is really, really tough to survive without being vaccinated, without having your booster shot. I don't know, but my gut, and I always listen to my gut tells me the age is going up, and the reason the age is going up is we're not boosted. And absolutely, that is something that we really need to take to heart in a big, big way. Our active cases are 11,491. We have 2,988 new positive cases today. Our daily positivity rate 17.79. Cumulative rate is at 8.12. Recovered cases around 435,000. You know, from all that, the active cases have dropped a little bit. The daily positive cases are still up around 3,000, and that's a lot. We've got 1,097 people that are hospitalized in West Virginia, and that's a new record high. We have 235 in the ICU units and 124 on ventilators. You know, many, many prayers for all those folks. A lot of those folks are in real trouble. You know, please offer up your prayers for all them. Our red counties still are coming down. This thing looks like, just like what Dr. Marsh has said. I mean, how many times has it got to be right for us not to listen to him? You know, but nevertheless, the map's looking better. The active cases are looking better. Still a bunch of positive cases here, but look at the age. The age, to me, is creeping up. And if the age is creeping up, we just don't have people that are getting their booster shots like they should. Okay, I've got a whole bunch of announcements, and I'm going to go through them as quickly as I possibly can. This one is absolutely dear to my heart because this one reflects how we're watching the store and doing our business in West Virginia. We have another incredible surplus in the month of January. You know, in December we came in, I think, at 133 or 131 or whatever like that. 131 or $3 million over the estimates. Well, in January, we came in at 136.8 million above estimates again. It's making our let me get this right. For a 7-month period, we are now at $530.6 million above estimates. Breaking all-time record after record after record. We know all that. We're breaking all-time records as far as unemployment in our state. We continue to set more and more and more records every single month as far as what our collections are, what our revenues are. I mean, I have said it 1,000 times. You can't find anybody on the planet that is more proud to bring these kind of numbers to you. And believe me, these numbers just didn't happen by somebody rolling off the pickle truck. I mean, really, when it really boils right down to it, people worked. A whole lot of people worked. And a lot of people took chances, and a lot of people absolutely had vision. And absolutely, without any question, so many people deserve a lot of credit in West Virginia, and more than anything, you the people, you're the stars. I've always known you're the stars, but this is unflat believable. Think about your personal income tax in the state of West Virginia is 12.9% ahead. Your, your year-to-date collections are $181.7 million ahead on personal income tax, collections. On consumer sales tax, we're $80.4 million above estimate. On severance, we're $163 million above estimate. On corporate net, we're 98.6 above estimate. All across the board. This isn't just sales tax. It's not just severance tax. It's not corporate net. It's not personal income. It's everything. It's everything. And absolutely, really and truly, when you get the snowball rolling down the side of a snow-covered hill, like the Temptations said a long time ago, it gets bigger and bigger. And this snowball includes everything, everybody. And so let's just keep it going, for crying out loud. Let's be prudent in our judgment in what we do going forward, and don't just throw the money frivolously away. Let's absolutely, in my opinion, we ought to put a major amount of these monies into a fund to where we can go out and attract more and more and more great businesses to West Virginia. Look what we just did with Green Power and Owens & Minor and of all things, Nucor. I mean, my gracious, that will absolutely set this state up to go for decades and decades to come. That's the kind of stuff we need to be doing. The CMS, which just came out, and everything. We wrote a letter to. This was, the governor of Tennessee, the governor of Virginia, and myself, and requesting that we get some kind of relief from these crazy mandates from the Biden administration, to where basically people were getting fired in all these healthcare facilities and everything because of mandates that you had to be vaccinated. We in our rural hospitals are destitute to keep the doors open as far as staffing, and absolutely we have got to do that. And so with all that, we sent a letter up basically asking for some kind of waiver in regard to that. They have come back to us, which is amazing, other than just say, no, they don't want to do that or whatever. They've come back to us and said, we'll talk, which I think is major progress. So tomorrow, our people and the governor of Virginia's people, Glenn Youngkin and the governor of Tennessee and everything, all of our folks and everything are going to be on the phone with them, and maybe we can come up with some level of relief for our rural hospitals. I still stand rock solid behind the fact that you should be vaccinated. Absolutely, without any question whatsoever, you should be vaccinated. And you're being absolutely headstrong foolish if you're vaccinated to not get your booster shot. If you can't see these numbers going up on age and be worried about it, then there's something wrong. I mean, absolutely, with all in me, you should be vaccinated and you should be boosted. But we can't let our hospitals close their doors. That's all there is to it. And we got to be totally respectful, and I've said it 1,000 times, respectful of people's wishes and honor their freedoms just as much as we expect them to honor ours. From the standpoint of the antibodies, like I've said over and over, they have discontinued a couple of them and everything. There's still a couple of them out there, but the two that they discontinued, they felt like that those were not helping us with the Omicron virus and or strain or variant rather. From the standpoint of home health tests, you can get 2 free home health tests and everything from for every household. From the Biden administration by coming to our COVID test, covidtest.gov. It's right there on the screen. From the mask standpoint, they'll be made available at the pharmacies. You should be able to get them now, and that is you should be able to get 3 N95 masks per person. Of course, everybody knows the N95 masks are the best. Just a report on our great National Guard. Right now, the numbers that I have, and I'm sure this number's a little low, 275 Guard members have been deployed now to 34 facilities. Gracious goodness, what work they do. It is amazing. Reminders again, if you're 65 and older, I've said it 1,000 times, you're 65 and older, you get any symptoms whatsoever, please go get a test. Please go get a test. There are still antibodies available that can save your life, but we got to catch it early. We've got to catch this early. From the standpoint of face coverings, if you're going out in a crowd of people and everything, you're 65 and older, you have any pre-existing conditions at all, please consider wearing a mask. I've said to you over and over about the booster shot. There's no point in me just going over that again. We continue our numbers, continue to rise just little by little. We're at 70.9% of the 18 and over right now that have gotten one shot. That's really decent and everything, but we got to keep going. We just got to get better and better and better. We have now given out 383,601 booster shots in West Virginia. And that's progress, but we still, get this. We're still at 51.8% of the people that are 50 and older that have received their booster shot. And 57.2% of the 65 and olders have received their booster shot. Now listen to me, please. We're leaving a great big delta of people that are on the table right now that absolutely have not gotten their booster shot. We've gotten a lot of them, 383,000. And we continue to get more and more and more. Every time we come on, we continue to get more. But absolutely, with all inmate, did you not just see all these names of people that I just read? 51 names, 2 in their 30s, 2 in their 50s, 2 in their 30s and 2 in their 50s, and all the rest older. Now, if you happen to be 50 and older, or you happen to be 65 and older, and you absolutely are fully vaccinated, and 51% of the 50 and olders and 57% of the 65 and older are all that have gotten their booster shot, what are we doing? What in the world are you doing? How on earth are you exposing yourselves to this kind of sickness and this kind of absolute, just terrible outcomes? You got to get that booster shot. Okay, all of our COVID information's up on the website. I encourage you to take advantage of all the free testing. I always thank Fruth and Walgreens, and I mean that from the bottom of my heart. We got 160 outbreaks in our long-term care facilities, 1 outbreak in our church community, that's in Nicholas County. We now have 876 inmates at our 23 facilities, that have COVID. And we have 234 staff members, well over 1,000 people. In fact, it's 1,100 people, it is 1,110 people, right on the money. It's amazing. Rental stuff, if you're a renter or landlord, call us. We may very well be able to get you some real money. I encourage you about giving blood. I've said that over and over and over. And proudly today, I've signed a proclamation to declare February as Black History Month again in the state of West Virginia. West Virginia has been home to some of the absolute most, influential African American scholars and leaders. And this month, we want to take time to honor their lives and their legacies. It's important stuff, really, really important stuff. And the more we know, the more we learn, the more educated we are, just the better people we are in every way. We lost a Supreme Court justice. We lost, our Supreme Court Justice Edwin Flowers. He died at the age of 91 on Thursday. Flowers served us in 1975 following the resignation of Justice James Marshall Sprouse. And Jim Sprouse, I knew him well. He lived, his home was in Monroe County, and I can remember thousands of times going by his home and thinking how beautiful it was and everything. And, we miss him. We surely now mourn Justice Edwin Flowers. And he served through 1976. Kathy and I surely send out our condolences, and I will issue a proclamation to lower the flags to half staff on the day of his burial. So God bless him and his family in every way, and please keep them in your prayers too, please. I just did an announcement this morning of Game Changers in Greenbrier County. It was really good stuff. Game Changers is doing great stuff, and I think between what we're doing with communities and schools, they're way out ahead. Like I said, the Communities and Schools program is phenomenal, touching absolutely 70,000 plus kids right now in 31 counties and spreading all across our state and doing great work. And Jobs and Hope is absolutely doing some really solid, rock solid work. Game Changers is addressing our opioid and our addiction rates and everything with our kids and exposure in every way with our kids. Game Changers is now another arm, another absolute weapon in our battle to stop this terrible scourge with all this drug problem across our country. It does it in a positive type way. So today we added in Greenbrier County, we added Greenbrier East and Greenbrier West, and absolutely we're going to continue to add schools right along. But I congratulate Joe Bozick and all they're doing. Proud to be their head coach, and this is just another great arm that we have with Communities and Schools and Jobs and Hope, and we're going to keep at this and everything and try to help our kids, try to help all in West Virginia that have any kind of addiction issues or any kind of problems or just a lack of education. What we can do is just real simple. You can say, well, I don't know if it's going to work. I don't know, if this will be the end-all, do-all and everything. But absolutely, we do know this. If we don't try, if we don't really try, then nothing's going to work. We absolutely know with all in us, all the accomplishments and everything that Communities and Schools has done. We all know with all in us and everything what Jobs and Hope has done and how many lives it has turned around and everything. It's amazing. We need these people back. We need them back in every way. And so with this, we can attack and we can address our kids and we can do absolutely more and more good work. Last thing I have, Groundhog Day. Groundhog Day, Brother Phil came out and said we're going to have another 6 weeks of bad winter. Well, just to tell it like it is, over the last 120 years, we've rolled Brother Phil out, and he's been right 36% of the time. Well, absolutely, we all need to pay attention to Brother Phil, but in all of that, Baby Dog just kind of waddled into the bedroom, last night and everything, and she said, make sure everybody knows my prediction. Now, Baby Dog almost predicted the Super Bowl score last year to the point. Not only did she hit the winner, not only did she hit the over-under exactly right, but she absolutely almost predicted the score. So you ought to listen to her, but she says absolutely without any doubt, and she told me that she predicts an early spring and good weather on the way. We're going to go through a little bit more winter, but Phil is wrong. And so we're going with baby dog. So nevertheless, God bless you. Thank you a bunch.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. In reinforcing a couple of the very important points the governor brought up, number one is the evidence for the importance of booster shots in our eldest members of our state's population, country's population, is really incontrovertible at this point. We know that there is 100 times improvement in protection from death if you're over 65, if you've had both vaccines and a booster versus being unvaccinated, that your risk of being hospitalized is improved by 49 times if you're fully vaccinated and boosted versus if you're unvaccinated. And if you're not boosted but fully vaccinated, that protection from hospitalization goes 49 times protection down to 17 times protection. And as the governor has rightly pointed out, that there are older West Virginians that are dying of COVID-19 and having breakthrough infections of COVID-19 more than we've seen in a while. And we know that it's really important because the vaccines do lose some of their potency for our most vulnerable citizens. And that would include everybody over 50 in West Virginia based on the data that we have, should absolutely get boosted. And that's really important because the governor pointed out that it looks like our cases may be plateauing and maybe even starting to come down on the other side. We know our reproductive score has been less than 1 now for several days. And so as we anticipate next steps, then we can pretty much anticipate that hospital numbers will be the next thing that we'll have to watch very carefully. We were at, I think, 1,097 West Virginians in hospital beds today, and that's almost at the same level as yesterday, which is our all-time record high. And we also know that data from the United States and the world would say that the US is seeing a disproportionate number of people die from COVID-19. When we look at the Omicron variant, and we've talked about on a person-to-person basis, it may be a little bit less severe, but because of the great numbers of people infected, some people project that we may see as much as 40% of the entire US population infected over an 8-week period of time with the Omicron variant. The average daily number of deaths is higher than Omicron than we had seen at any point during the Delta pandemic. And we are seeing in the United States, our death rate far exceeds other rich westernized countries. And that's because of 3 factors. It's belief. Number one is we are not fully vaccinated to the level we should be, that many other more westernized, richer countries are vaccinated. Number 2 is we are poorly boosted. And number 3, we have other coexisting medical conditions. And the most important one may be obesity, both for adults and children. So ultimately, as we look at our older population that is inherently more susceptible, then we very much want to encourage people to get boosted, particularly as we anticipate the number of deaths will go up in the next 2 weeks or so. And we believe that window still exists for people to protect themselves in these vulnerable age categories. The last thing I want to mention is that Pfizer is going to present, or is at least petition to present its data on vaccines in 6-month-olds to 5-year-olds to the FDA on February 15th. And that is going to be an opportunity where Pfizer and the FDA will start to look at the data from the clinical trials and determine whether or not there's enough information, enough data there to give an emergency use authorization for the vaccines for children that are under 5. And as we've talked about here before, at every age grouping, the dose of the vaccine has gone down. This amount of vaccine is 3 micrograms. Children over 5 are immunized with 10 micrograms, and children under or over 12 are immunized with 30 micrograms, the adult dose. And because of the small dose, there has been the findings, at least it's been reported out, that in 6-month-olds to 2-year-olds, there has been an increase in the antibodies sufficient that there appears to be clear protection against those young people. In the 2-year-old to 5-year-old group, the protection of antibody levels is not as high, and therefore Pfizer is looking to add a 3rd shot to that regimen. Currently it's 2. And this will be an interesting debate and decision point from the FDA and the CDC about whether to approve these drugs to get the kids started, because the belief is that even though the antibodies in the 2 to 5-year-olds didn't go up as much as they did in the 6-month-old to 2-year-old group, that the protection against severe disease may well be there. And we have pointed out before that hospitalization in children have been greater with this Omicron variant than what we've seen before. So more to follow, but really important to heed the governor's advice and counsel. Please, 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 if you're over 50, and particularly if you're over 65, make sure you're fully vaccinated and boosted. Really important. That's going to help what we need to do in the next few weeks very dramatically. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Use some data to highlight some of the governor's and Dr. Marsh's earlier points. One area that we really want to pay attention to in our hospital numbers, in addition to being at that almost 1,100 number again, 149 new admissions today, and we are up to 20 pediatric cases. So we still have some significant challenges there that we need to manage. As the governor pointed out, 34 hospitals are receiving assistance from the National Guard, as well as 4 long-term care facilities. That puts our number up when you add the 4 long-term care facilities to 286 personnel. We have the ability to go up to 350 National Guardsmen. So some great work over the weekend by the hospitals, the long-term care facilities, our National Guard team, and the JIADF staff to balance those loads out and make sure we still have reserve capability available. We did see this week an increase in our antibody shipments for the sotrovimab from 312 courses to 360. So that is a good progress to help us out, but not nearly the amount we need. It also highlights the numbers that the governor pointed out related to the fact that we need to get more people age 50 and age 65 and above boosted. If you look at our numbers over the past 2 months, from December to January, our average age of death went from 69 to 71. Again, reinforces what the governor's talking about related to those booster doses and how important they are. And earlier today, Dr. Marsh had sent us some information. If you look at the numbers that he talks about, just to put it in a maybe more simple term and format, if we had everybody boosted and having 3 doses, we would reduce, based on the statistics and the data, we would reduce our death rate by 99% and our hospitalization rate by 96%. So it's really, really important, as the governor and Dr. Marsh point out, that we've got to get West Virginians boosted, particularly our older population. Thank you.
All right, thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. Just a reminder, if you're testing positive for COVID-19, we are shifting our case investigation and contact tracing efforts. We do realize the health departments are having a difficult time trying to contact everyone. So you might get a text message from them about your COVID-19 status, but we also are trying different efforts as it has been close to 2 years and it is getting difficult to contact everyone. So some of our efforts are shifting where we are trying to contact more people in congregate settings or larger institutions. So some of these efforts are driving these efforts to get people notified in a different manner. So you might not be getting called, or we are trying to contact people who maybe don't get text messages, maybe some older people who don't use cell phones. But these are efforts to try to drive public health messaging and efforts to get people notified. But it is important that if you test positive, to notify anyone that you've been close contact with and to self-isolate and self-care. But these are efforts to just try to drive these messages home a little faster and get notified, but to also contact your healthcare provider. Thank you.
Thank you, Doctor. Secretary Bill Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Get this emergency use authorization. I know that our 5 to 11 age group remains the least vaccinated. I think we're somewhere around 13% are fully vaccinated. So what do we plan to do to convince, parents of even younger children that this is the right step to take? Thank you.
Dr. Marsh, did you get the question, or did?
I think I did, Governor. I think that Charles was asking, because of the low vaccination rate in our 5 to 12-year-old group, how will we work to convince our younger age children and parents that that may be important to vaccinate them? And so thank you, Governor. Thank you, Charles. Charles, I think that what we are very much trying to do, as we have talked about a lot during these briefings, is to try to make sure that we are facilitating and making it convenient and providing access for all eligible West Virginians to be able to receive the vaccines as we have clearing approval from the Food and Drug Administration and from the Centers for Disease Control. And certainly as we start to look at hospital numbers around the country and new cases around the country, we do know that children have been impacted in a much more significant way with the Omicron variant than we've seen before. As we talked about in the country of South Africa, through all other phases of the pandemic, they saw about 2 to 3% of all hospitalizations be in children. With the Omicron variant, they saw about 14% of the hospitalizations be in children. And although we have not seen soaring numbers, as General Hoyer talked about today, we did see for the first time 20 pediatric admissions to the hospitals. So we would be strong advocates for consideration of immunization in all the approved age categories. We will wait to see what FDA and CDC does with the data in the current from the current clinical trials in 6-month-old to 4-year-old children that will firm up that gap that we have right now. And we anticipate there'll be some debate because, as we talked about, in the youngest children, 6 months to 2 years, there seems to be a signal with the antibody response with 2 shots. That is what we would hope and anticipate. But in the 2-year-old to the 5-year-old or the end of 4-year-old group, that antibody response was not quite as robust. So the company is already planning a 3rd dose of vaccine. And because there is an ongoing sort of additional part of that trial, but Pfizer is going to move to the FDA because of this impact in children to try to give children an opportunity to be vaccinated. That's going to be a very interesting discussion from FDA and CDC. So if that does get approved, we will make those available for all children in West Virginia as soon as it's approved. And we would hope that parents would take advantage of that to reduce the risk of the most severe consequences of COVID-19 illness in their children.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, is there any thought to the specific arguments that will be made when talking with the representatives of the Biden administration and the healthcare factions tomorrow when we meet about the possible exemption to the vaccine mandate? Specifically, what will the state be arguing? Thank you.
Well, I mean, General, would you like to take this? I mean, I can do it, but we'll go ahead.
Yes, I'm happy to, Governor. So, Kenny, part of the issue is we look at numbers, and the Secretary and the Governor's staff and I were discussing this earlier today. The larger percentage or areas where we have staffing issues right now are in our rural facilities, and we also have challenges normally there within the system with just getting staff. So when you have COVID staff, COVID causing additional staff outages, you create challenges. So what we've been asking for is for the governors to have the flexibility to manage that based on our state and our requirements, and to do the best we can to maintain healthcare access for our rural West Virginians. So we're looking at that. We're looking at the normal staffing challenges that already exist, and just trying to be prudent and giving the governor and his team the appropriate extra tools to be able to take care of our citizens.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel and fellow journalists. I have a question about masks. If someone is relying on their old mask until they get the new K95 or KN95 mask, how good is that mask? Does it do you any good to wear that at all? Is it better than nothing? Maybe on a scale of 1 to 10, where does it fit? And how good is the upgraded mask going to be if you're trying to prevent contracting the virus that way? Thank you.
Dr. Amjad, please.
Yes, Governor. Paul, those masks in a perfect setting really are supposed to only be used, per patient. That's what the hospitals would say. If we had an abundant supply, we use them per patient. But now if you're just using it in the public setting, I would say a couple of days. But if you're using it a lot, I mean, you can kind of see if it's being worn down, I would say. But I would use mine for, I would say, about a week or so at least. But if you can't get them in an abundant supply, and it might sound kind of funny, but I mean, if it smells bad, or you've been wearing it a lot in a restaurant or running around with it, and you can see through it, I would think it's not very good. But I mean, most people have been wearing them for at least a week or 10 days or so. But then, but I would think if it starts to smell bad or you can see holes through it, I would get rid of that mask, Paul, and try to find another one. But I don't know. Hoyer's laughing at me, but I think you could tell when it's pretty run down and get another one.
All right, thank you, Paul. Next, we'll go to Mark Cram with WDVM.
Good afternoon. This is my first opportunity to join you fine folks since the governor's come back. And so, Governor, it's good to see you fine and fit there once again. I'm starting to see reports now about a subvariant. Up to this point, I think we've heard a lot about variants, but now this subvariant to the Omicron. I'm curious if someone has had the Omicron, are they also susceptible to this subvariant, or is it kind of got them covered once they've had Omicron? And once again, thanks for all of your time.
Dr. Marsh, please. Mark, thank you so much for the kind words.
Thank you, Governor, and thank you, Mark. Well, what you're speaking of, Mark, is a subvariant of the Omicron virus, the Omicron variant. And there's really two that are important right now, both in West Virginia and across the world. And the virus that we're seeing exclusively here from the Omicron is called BA.1, which is the original variant of the Omicron that has circulated around the world, circulated in South Africa, and is 100% of our Omicron cases. The second variant that some people have termed the stealth variant is a second form of Omicron called BA.2, and it is a bit different than Omicron. It's about as different from the variant of Omicron that we're seeing, the subvariant, as the original virus was to the virus from the United Kingdom. So it is a substantial amount different, and it does seem to have an easier time infecting people. It's about 1.5 to 2 times more infectious than the Omicron variant that we have here in West Virginia. The important finding is that if you're fully vaccinated, you're protected against both variants very well. The BA.2, the second variant of Omicron, is not more severe than the version that we have here in West Virginia, which is good. But what has been found is if you have only had a very mild case of the BA.1, the Omicron variant that we have in West Virginia, then you still have the potential to get reinfected by the second subvariant, the BA.2. But currently in the US, we have not seen a substantial issue with secondary infections with the BA.2, and we don't anticipate we'll have that in West Virginia either, given that 100% of the sequencing cases we've done are the BA.1, the original variant of Omicron. I hope that helps.
All right, thank you, Mark. Governor, I'll turn it back to you.
Okay. I don't know how many listeners we've still got up, but I want you to really listen to me. And I want our media to listen as well. You know, because I can really make this really, really simple. You know, I'm a numbers guy, and no one told me, you know, well, you know, here's the percentage of how the age is moving up or down or whatever. All I do is look at numbers all the time, and I'm a numbers guy. And I can dissect the numbers pretty quickly. From all this, I would just tell you just two things. Two things that are being said, in fact, three things. And I'll make this as simple. Absolutely, it is beyond belief simple. The real truth is just this. We're having more pediatric cases at our hospitals today than we've ever had. Now, what does that tell you? It tells you that your children are absolutely exposed at some level. You need to move, and you need to react. We also can tell you without any question, it looks, at least to me, like the age of deaths is going up. Well, if that be the case, the logical thing behind it is, for crying out loud, we got 89% of the 65 and older people are vaccinated. 83% or whatever of our 50 and older people are vaccinated. Well, why in the world is the age going up? Because we've already had 5,014 people die. I'm sorry, 5,814 people die. How can the age be going up? And it's just as simple as mud to me. Absolutely, we are not getting our booster shots. Now, to me, it's your choice. It's your choice. You have the experts that are sitting here saying your babies, and by babies, I mean any of your kids at any age, are ending up, the numbers are escalating by the number of pediatric cases that we have in hospitals. They're telling you that. Without any question, I'm telling you, General Hoyer came in and told you the same thing. The age is looking like it is moving up, and that is a direct reflection, it has to be, a direct reflection of the booster shot. Now, also, if you'll just stop and listen to these experts, I don't know if it was Dr. Marsh or General Hoyer. I think General Hoyer. He said, if you'll just take today's deaths and say, we had them all boosted, we could, or maybe all the deaths, the recent deaths that we've had, not just today, we had them all boosted, we could cut the number of deaths by 99%. It's unbelievable. That's just all there is to it. We could cut the hospitalizations by 92%. Now, the only other thing that I would add is just one other thing. Kenny Bass always asks some really intelligent and really important questions. And I just, you know, I like listening to Kenny because he's a sharp guy, really sharp. And, you know, but now just think just 1 second. Here's the straight skinny, and let's just make it real simple. If we've got rural hospitals and we continue down the path of being just pushed with more and more people that are needing to get treatment, some level of treatment in our rural hospitals, what's going to happen? What is going to happen? You're going to have one of two choices in my book. And this is exactly what our waiver is all about. One of two choices. We're either going to risk closing the hospital, or those folks that are going to, in a rural hospital, there may be 3 people in the entire hospital that were not vaccinated and didn't believe they ought to be vaccinated, and we're asking that they be allowed to work. How many people are you encountering when you go in Walmart or wherever? How many people are you encountering at a high school basketball game that are not vaccinated, that are unvaccinated? I'm saying hundreds upon hundreds upon hundreds. Well, if that be the case, what we're asking the federal government to do is give us some level of relief that we can keep the hospital open. It's just that simple. Well, sure, we may have a few healthcare workers that just refused and didn't want to take the booster shot that are allowed to keep working there so we can keep the hospital open. It's just that simple. It's one of two choices. We may be at the brink of closing the hospital, or we may be at the brink of keeping it open, and you absolutely knowing that there are 2 or 3 or 4 or 5 or whatever it may be, not very many of the healthcare workers that are there may not be vaccinated. I'm telling you, there is no choice. There is no choice whatsoever from the standpoint that our kids, the cases on our kids are going up in the hospitals. The cases of people dying, the age is going up. The reason that age is going up, in my opinion, is we're not getting booster shots. Now, I'd put it to you just like my dad would put it to me. You decide. You decide. That's the facts. It's time. You decide. So with all that being said, I love you, and I hope you make the right decisions. Be good. Thank you.